why your mouth feels dry all the time, and what is the hidden health warning behind dry mouth. To know the truth, watch this video. Imagine waking up in the middle of the night. Your mouth feels like sandpaper. Your tongue sticks to the roof of your mouth. You reach for water again and again, but the dryness never really goes away. Many people think this is just dehydration, but what if your dry mouth is actually a warning sign from your body? A warning about diabetes, autoimmune disease, medication side effects, nerve damage, or even cancer treatment. Doctors call this condition xerostomia, and millions of people suffer from it without realizing that it can lead to severe tooth decay, infections, difficulty swallowing, speech problems, and even serious health complications. In today's video, we will uncover what dry mouth really is, why it happens, dangerous symptoms you must never ignore, diseases linked to dry mouth, tests doctors use to diagnose it, the most effective treatments, and simple ways to prevent it. Stay with me until the end, because one very common medication used by millions of people may be causing dry mouth without them knowing it. And it might surprise you. Our mouth produces something incredibly important every second of our lives: saliva. Saliva may seem simple, but it is one of the most powerful protective fluids in the human body. Every day, the average person produces 0.5 to 1.5 liters of saliva. Saliva helps with digestion, swallowing food, protecting teeth, preventing infections, maintaining oral health. Without enough saliva, the mouth becomes dry. This condition is known as xerostomia. What is xerostomia? Xerostomia simply means a feeling of dryness in the mouth caused by reduced saliva production. But there are two important medical terms doctors use: xerostomia, the subjective feeling of dry mouth, meaning the patient feels dryness, even if saliva production may still be normal. Hyposalivation. This means actual reduced saliva production measured by medical tests. In simple words, term, meaning xerostomia, feeling of dry mouth; hyposalivation, actual low saliva production. Many people experience both. Why saliva is important? Saliva does much more than people realize. It contains water, enzymes, minerals, antibodies, protective proteins. These substances help: 1. Protect teeth. Saliva neutralizes acids produced by bacteria. Without it, tooth decay increases dramatically. 2. Help digestion. Saliva contains an enzyme called amylase. Amylase helps break down starch into sugar. Digestion actually starts in the mouth. 3. Prevent infections. Saliva contains antibodies and antimicrobial proteins. These fight bacteria, viruses, and fungi. 4. Help you swallow and speak. Saliva lubricates food and helps it move smoothly down the throat. Without saliva, swallowing becomes difficult, speech becomes uncomfortable. What are the signs and symptoms of dry mouth? Many people ignore the early signs, but dry mouth often produces very noticeable symptoms. Common symptoms include sticky or dry feeling in mouth, constant thirst, cracked lips, bad breath, difficulty chewing, difficulty swallowing, difficulty speaking. Tongue symptoms. The tongue may appear dry red, cracked. Burning. Some people develop burning mouth syndrome. This causes burning sensation, tingling, pain in the tongue. Dental problems. Dry mouth increases risk of cavities, gum disease, oral infections. Dentists often notice multiple cavities in unusual locations in patients with xerostomia. Major causes of dry mouth are: dry mouth has many possible causes. The most common causes include 1. Medications, 2. Dehydration, 3. Diabetes, 4. Autoimmune diseases, 5. Nerve damage, 6. Cancer treatment, 7. Aging, 8. Mouth breathing, 9. Smoking and alcohol, 10. Stress and anxiety. Let's explore each cause. Medications. The most common cause. One of the biggest causes of dry mouth worldwide is medication. More than 500 medications can reduce saliva production. These include drugs used for depression, anxiety, allergies, high blood pressure, pain, Parkinson's disease. Why medications cause dry mouth? Many medications affect the autonomic nervous system. This system controls saliva glands. When this system is affected, saliva production decreases. Common drug groups causing dry mouth. Antidepressants. Examples include drugs used to treat depression. These medications affect brain chemicals like serotonin, but they also reduce saliva production. Antihistamines. Used for allergies. They dry mucus secretions, including saliva. Blood pressure medications. Some drugs used for hypertension reduce saliva flow. Pain medications. Certain painkillers also suppress saliva glands. Dehydration. The second most common cause is dehydration. Dehydration means the body does not have enough water. When the body loses water through sweating, vomiting, diarrhea, fever, saliva production decreases. Signs of dehydration: dry mouth, dark urine, fatigue, dizziness, headache. Diabetes and dry mouth. People with diabetes frequently experience dry mouth. In diabetes mellitus, blood sugar levels become high. High glucose causes dehydration, increased urination, reduced saliva. Dry mouth and diabetes may also occur due to nerve damage, medications, infections, autoimmune diseases. Some diseases attack the body's own tissues. These are called autoimmune diseases. One important condition linked with dry mouth is Sjogren's syndrome. This disease attacks salivary glands, tear glands. It causes dry mouth, dry eyes. Doctors call this combination Sika syndrome. Nerve damage. Saliva glands are controlled by nerves in the face and neck. If these nerves are damaged, saliva production decreases. Causes include surgery, trauma, neurological diseases, cancer treatment. Cancer treatments can severely affect saliva glands. Radiation therapy. Radiation used for head and neck cancers may damage salivary glands. This can cause permanent dry mouth. Chemotherapy. Chemotherapy may temporarily reduce saliva production. Smoking and alcohol. Smoking irritates the mouth and reduces saliva. Alcohol also causes dehydration. Together they increase risk of chronic dry mouth. Mouth breathing. People who breathe through their mouth often wake up with dry mouth. This may occur due to nasal blockage, sleep apnea, allergies, aging. Dry mouth is more common in older adults. However, aging itself is not the main cause. The real reason is increased medication use. Chronic diseases. Complications of dry mouth are, if untreated, dry mouth can cause serious complications. Tooth decay. Without saliva, bacteria produce acids that damage teeth. Gum disease, also known as periodontal disease. This infection damages gums and bone around teeth. Oral infections. Fungal infection called oral candidiasis is common. Symptoms include white patches, burning mouth, redness, difficulty swallowing. This condition is called dysphagia. Food may feel stuck in the throat. When should you see a doctor? You should seek medical advice if dry mouth lasts more than 2 weeks, causes difficulty swallowing, causes severe thirst, causes frequent cavities, occurs with dry eyes. These may indicate underlying disease. Investigations for dry mouth. Doctors use several tests to find the cause. 1. Medical history. Doctors ask about medications, diseases, lifestyle habits. 2. Saliva flow test. This test measures saliva production. Normal saliva flow, 0.3 to 0.4 ml per minute. Low saliva flow indicates hyposalivation. 3. Blood tests. These may detect diabetes, autoimmune diseases, infections. 4. Imaging tests. Doctors may use ultrasound, MRI CT scan. These examine salivary glands. 5. Salivary gland biopsy. A small tissue sample is examined under microscope. This test helps diagnose Sjogren's syndrome. Treatment of dry mouth. Treatment depends on the cause. 1. Treat underlying disease. For example, controlling diabetes, Managing autoimmune disease. Adjusting medications. Suck artificial saliva. Doctors may recommend saliva substitutes. These lubricate the mouth. 3 saliva-stimulating drugs. Certain medications stimulate saliva glands. 4 good oral hygiene. People with dry mouth must maintain excellent dental care. Home remedies are: simple lifestyle changes can help. Drink water frequently. Small sips throughout the day keep the mouth moist. Chew sugar-free gum. Chewing stimulates saliva production. Avoid caffeine. Caffeine worsens dryness. Use humidifier at night. This adds moisture to the air. Avoid alcohol mouthwash. Alcohol dries the mouth. Foods that help dry mouth. Certain foods stimulate saliva. These include citrus fruits, crunchy vegetables, sugar-free candies. Preventing dry mouth is possible. Key steps include: stay hydrated, maintain oral hygiene, limit smoking, avoid excessive alcohol, regular dental checkups. Future treatments are important. Researchers are studying new therapies such as stem cell therapy, artificial salivary glands, regenerative medicine. These may provide long-term solutions. Warning signs are: dry mouth may signal serious disease. Never ignore symptoms like dry eyes plus dry mouth, severe thirst, sudden dental decay, difficulty swallowing. These require medical evaluation. Dry mouth may seem like a small problem, but it can affect digestion, dental health, quality of life, overall health. Understanding its causes can help prevent complications, and sometimes dry mouth may be the first sign of a hidden disease. So always listen to your body. If you learned something new from this video, please like this video so more people can learn these life-saving facts. Subscribe to the channel for more doctor-explained health videos in simple language. And comment below: have you ever experienced persistent dry mouth? Your story may help someone else recognize the warning signs early. Stay healthy, stay informed, and I will see you in the next video.